guys, Nurse Alyssa here. Today I'm going to be talking about head trauma and concussions. But before we get started, if you could hit the like and subscribe, it would be greatly appreciated. So let's get started. At one point in all of our lives, either we have hit our head, we know somebody who has hit their head, or we've had a child and we all know within the first few years of their lives they're quite clumsy and hit their head quite frequently. Now, not all head trauma causes a concussion. So if it's just a mild head trauma, you will just see some bruising, some redness, maybe even a quite large goose egg. But this can be treated at home. It's not something they need to go to the hospital for. You can just put an ice pack on the spot. It will reduce the pain, reduce the swelling. If you need to, you can administer a mild pain medication like Tylenol for just the mild symptoms. Now, more severe head trauma that causes an actual brain injury, or better known as a concussion, is more serious. So a concussion is when we hit our head or jolt our head in a way that our head and our brain rapidly move forward and backwards. Now, the signs that you want to watch out for, we have two major ones, is loss of consciousness and vomiting. Those are our two major ones, but we also have severe headache, increased pressure in the head. It feels like your head has a lot of pressure in it. Dizziness, confusion, or even amnesia, where they just don't even remember what has happened. If a person is experiencing any of these symptoms, they should seek medical care because a concussion can cause a brain bleed or brain swelling. This can be fatal, so you do want to seek medical attention. It is also important that anybody who has had any head injury is watched for the next 24 to 48 hours, especially if it's a child, just that they don't have increase in symptoms, any new kind of side effects going on. And you should, if they are going to sleep, you should be waking them up every 2 hours to make sure that they are easily awoke. And if they're not, you should be seeking medical care. So these are just my suggestions as a nurse. You need to understand that I don't know your specific case, and you do need to use your judgment if you should be seeking medical care or not, because I do not know your case. These are just my suggestions that I'm giving. So with that said, that's all I have for this video, and I'll catch you next time. Bye.